Hi, this is Shuping. I'm the nurse today. So my patient is Serena Trapp. She have UTI and stay in the hospital. The doctor ordered her some medication. So now I'm going to give her some medication. Then I'm going to the med room, wash my hand, and check what kind of medicine she have. So in the orders, she have 0.9% sodium chloride, which is 1,000 milliliter in IV. So I draw up the medication. This is 1,000 millimeters of 0.9 sodium chloride IV. And the order rate is 125 milliliters per hour. Patient Arena Trapp, MRN 1383442. This is the right patient. And now is almost the right time to administer the medication. Sodium chloride, yes. And the other one is cefazolin, which is the antibiotic because she have the UTI. And then it says cefazolin 500 milligrams in 50 ml, IVBP, Arena Trapp, MRN, checked. And I calculate the medication is 34 drops per minute. This is the right one. And since she have a history of nausea and vomiting using the cefazolin, so the doctor ordered her ondansetron, the Zofran, 4 milligram. Okay, then I'm going to perform hand hygiene again. Gloves. I'm going to prepare the ondansetron. So this is ondansetron, 2 milligrams per ml. The doctor ordered 4 milligrams, which means 2 milliliter. So this is for IV push, right medication. And then I have the 3 milliliters syringe and a needle. So I put it here. Got the alcohol wipe to wipe the vial for 30 seconds and let it dry. Now it's already 30 seconds and it is dry. And I draw 2 milliliters of air. Inject the air. And make sure there's no air bubble. And I draw 2 milliliter. Good. Okay. And recap it. Okay. So ondansetron, 4 milligram, 2 milliliters. Right patient. Right MRN. And I also check the med book on ondansetron. I have to give it around 2 minutes. So those are the medication. And I also need some alcohol wipes. And then the normal saline flush. And the primary and secondary IV line. Okay. So now is this the right one? Then I close the close the order on Pixie. Discard the gloves. Perform hand hygiene. And then I go to the patient's room. Okay. Okay, before I go into the patient's room, check if there's any sign of infections or precaution. So there's no any precaution, I don't have to wear my PPE. Then I just go direct to the room. Knock knock. Hi, this is Shuping. I'm your nurse today. How are you doing today? Good. Alright, so can you tell me your first and last name and your date of birth? Good. Can I check your waistband? Urinary tract, MRN, correct. Okay, then I'm going to perform a hand hygiene, open the MAR, and since you have a UTI and in a hospital and the doctor ordered you some medication which is 0.9% normal saline, and then cefazolin, which is the antibiotic, and ondansetron because you might have nausea and vomiting by using the antibiotic, okay? Do you have any other question? No? Can you tell me if you have any allergy? Mango? Alright, so allergy mango, which is correct. No other medication allergy? Okay. Alright, so I'm going to prepare you for the IV medication. Let me put everything here so that I'm good. Then hand hygiene. Put on gloves. And before I give the medication, I check the MAR again to see it is the right patient, right time, right medication, right route, and right dose. 3 of the medication are right. So now I'm going to check your skin to see if any phlebitis, no warmth, no infiltration, the IV site looks good. Then I'm going to use the alcohol wipe to wipe your port around 30 seconds and let it dry. I'm going ahead to give you some normal salines to flush it, okay? Normal saline. It's already dry. Sterile to sterile. Okay. Then I'm going to push it slowly. Make sure I give you around more than 5 milliliters. Okay, lock it. Good. Your IV size looks very good. No blood clot. It's patent. And then now I'm going ahead to give you the ondansetron. Ondansetron. Sterile to sterile. Make sure there's no air bubble. Okay. Unlock it. And administer 2 milliliters, 4 milligrams in 2 minutes. Very slow. One minute passed. And 2 minutes passed. Lock it. And then I'm going to discard those in a shot container and flush with the normal saline. Sterile to sterile. To make sure all the medication go into your vein. And I flush it slowly. Good. Okay, locked. Okay. All right. Your IV size looks good. And then now I'm going ahead to give you some sodium chloride, okay? So here's 1,000 milliliters of sodium chloride. I calculate the math is 21 drops per minute, and it is the right patient. Then I'm going ahead to give you, open this. Alright, so I open this cap and open this cap, sterile to sterile. And I make sure I claim it so the medication is not dropping. Hang it. Make sure the IV line is not kinked. Okay. Then now I'm going to use the alcohol wipe to wipe your port about 30 seconds. Okay, now it's 30 seconds and wait for it to dry. Okay. Then I'm going to unclaim it, squish the chamber. Like in the halfway. And I open the claim. Make sure there's no air bubble. Okay. Okay, claim it. So this one is already clean. Attached. Unclaim it. So set it to 21 drops per minute. Okay, so it's around 5 to 6 drops per 15 seconds, which is great. Okay, now I'm going to give you the cefazolin IVBP. So I get the secondary IV set, and then make sure this one is, the primary one is lower than the first one, the secondary one. Lower than the IV piggy bag. Okay, here you go. Lower, and then I'm going to sterile, open this one, give it the medication, and make sure the claim is already claimed. This is already claimed, so no dropping. No medication dropping. Open the claim. Okay. Good. So no air bubble in the line, and I set it to 34 drops per minute because I have to give it in 15 minutes. And then I use the alcohol wipe. Wipe is 30 seconds. Wait it to dry. Open the clean. This one, sterile to sterile. So no air bubble all the way down. And I unclaim it. Check the rate. Good. And I unclaim this one. The primary one. Make sure both of them are in the right rate. Good. Okay, now the IV medication is already done. Then if you have any questions, just let me know. I'm going ahead and lower your bed. Here's the collar that you can reach. I'm going to put my gloves off, do my hand hygiene, then I'm going to document it, okay? I will come back when your antibiotic finished. Hand hygiene and document in the EHR tutor in the MAR. Thank you.